Semaglutide reconstitution. So, what you're going to need first is a 3 ml 23 gauge syringe, right? This is a 5 ml sterile water for injection. And for today, we are going to reconstitute 2 mg in a 2 ml vial of semaglutide. So these vials, they come in 2 variations. There's a 5 mg in a 2 ml vial, and then there's a 2 mg, which I'm using now, in a 2 ml vial. So this is what we're gonna reconstitute today. And of course, this is your injection needle. This is a BD 31 gauge, 8 millimeter, 0.5 ml syringe. So this is half an ml, 50 to the mark. So basically 1 ml is 100 marks. So this is, since this is half an ml, it only goes up to the 50 mark. But for those of you that are doing the onboarding dose, recommended, it's recommended that you start on 0.25 and escalate. I recommend you escalate by 10 every, by 0.10 every 2 weeks. So the first 2 weeks, you're gonna wanna do 0.25, and on the 3rd and the 4th week, you're gonna wanna escalate up to 35. And if you're not obese, I would honestly stop on 40, because 40 is already, for this particular peptide, it's already pretty, you know, it does its work already. But you could go all the way up to 50 should you want to. But I would recommend, once you've reached the 40 mark, you could glide on that dose up until you'd want to escalate, only as needed. I've seen people do 1 ml, so that's to the 100. So you're gonna want to get a bigger needle for that. I mean, a bigger syringe for that. You're gonna want to get the 1 ml syringe for that. But those are already extreme cases of obesity. So basically, you'd want to just, you know, use the 50 or 0.5 syringe when you start. So reconstitution. Basically, it's 1:1. So if this is a 2 mg semaglutide, you're gonna want to put 2 ml of water. So if this was, for example, 5 mg, then you're gonna want to put 5 ml of water. So today we're using 2 mg. You're only gonna want to take 2 ml of your sterile water and throw out the rest away. I would go a little bit, since there's bubbles, I would go a little bit past the 2 and then just squirt out the rest. So, sure. There you go, perfect. On the 2 ml mark. And put the cap back on. Pop this open. Pop the cap this way. So it's a arranged peptide. Basically, it's arranged proteins in the peptide. So if you squirt water directly into the peptide, it will dislodge the proteins and causing it to be denatured. You'll know if it gets denatured once the water gets cloudy or it bubbles up inside your vial. Then you know that you've denatured your vial of semaglutide. So you don't want to shake it violently, and you don't want to inject straight into the peptide. What you're gonna want to do is inject from the bottom this way, like so, and inject straight up. Once you've got the needle inside, you tilt it to the side, aiming for the glass, and slowly push the plunger down. And let me show you how it's done. So make sure it's tightly, and like so. There you go. And now I'll tilt it this way and just let the water bounce off the glass. See? Let it fill up in that crevice in the bottom. All right. And there will be pressure, so don't let go of the plunger, and tilt it up this way slowly. See, look, now it goes up like that because of all that pressure that you put in. So if you let go of that plunger while it's still upside down, then you're gonna suck back the water back into your syringe. So once you let go, make sure that the water is on the other side of the vial pointing straight up. Now it's reconstituted. Don't shake it. So if you see some compounds or your peptide still not reconstituted properly, you see those little bits of powder floating around in the water, don't shake it. You could just put it between your palm of your hand and then do this. There you go. That's the reconstitution of semaglutide.